What's the joint that sits above the calcaneus and talus? Yep, the ankle joint. Now, when I asked sports medicine and biomechanics guru Simon Barthold if there was only one joint that he was allowed to assess and treat, what would it be? Barthold said, the ankle. I asked him, why? Barthold said, because it has such a dramatic effect on the structures close by, such as the plantar fascia and Achilles tendon, and as well as the knee, hip, and spinal joints above. If you need clear evidence-based assessment protocol, how to ascertain if your patient's ankle is functioning well, then welcome, you're in the right place. This video is for you. G'day, I'm Ted Jedynak, international educator and health practitioner with over 30 years clinical experience in treating MSK conditions of the foot, ankle, and the lower limb. I help foot fixers, podiatrists, physios, chiros, osteopaths, and other physical therapists take their skills and expertise to the next level so they can get the clinical breakthroughs their plantar heel pain patients expect. This 8th blog in a series of 8 is all about shortcutting your path through the conflicting research, the complex issues, and unpredictability that surrounds plantar heel pains. We're taking you step by step through the minefield of information that's out there to save you a heap of headaches. I've explained in the previous plantar heel pain blogs that I've sure had my fair share of headaches. I've gone from being a root theory junkie to a plantar fasciitis fanatic. And now, after some retail therapy, I reckon I'm on the straight and narrow path to a better understanding of plantar heel pains. I sure hope you are too. This blog series has dived into the biomechanical theories of plantar heel pains, plantar heel pain anatomy for accurate diagnosis, the differential diagnosis essential for effective treatment outcomes, treatment trial options to confirm your diagnosis, plus the roles and efficacy of orthotic therapies, both custom and prefabricated. We've also explored the top 5 tests for assessing orthotic efficacy. If you use orthotic therapy as part of your treatment for plantar heel pains, then last week's blog, number 7, is an absolute must for you and your treatments. Check it out if you haven't already, and don't miss out on the downloads, the freebies, and the popcorn to make your assessment, diagnosis, and treatment of plantar heel pains that much easier. Today's blog focuses on the ankle and its mobility because of its direct effect on the plantar foot structures. Plus, as Simon Barthold said, the influence of the ankle on the structures higher up the kinetic chain is also crucial for us lower limb practitioners. In this blog, I'll refer to the latest evidence on the ankle so that you know what the evidence base is telling us. Then I'll focus on the test many of us use clinically to assess the ankle range of motion dorsiflexion, the lunge test. And as you know, the lunge test, it's a simple test, but it's a significant test when performed correctly. So I'll highlight the 6 ways patients and practitioners can cheat and affect the lunge test results. This is going to be a cracker of a blog, so let's jump in. First, those of you who've trained with me will know how I refer to the talus by its former name, the astragalus. This is the name that still a number of European and South American countries use for the talus. Astragalus can be translated from its Latin roots to astra, meaning central star, and gallus, universe. So astragalus means center of the universe. And from a skeletal structural perspective, the talus is the central point that influences the entire postural network of the skeleton due to the influence of gravity. Now, from the evidence base, there's a selection of high-level research that confirms the importance of ankle range of motion, in particular the effect of limited ankle dorsiflexion on MSK conditions of the lower limb and beyond. We've got the effects of increasing ankle range of motion program on ambulation and balance for the elderly with balance disorder. There's postural control in single limb stance. The relationship between foot motion and lumbopelvic hip function, a review of the literature. Dynamic foot function as a risk factor for lower limb overuse injury, a systemic review. Age-related differences in foot mobility in individuals with patellofemoral pain. Ankle biomechanics during 4 landing techniques. And in today's freebie, we've got the links to each of these articles all ready for you. Some fascinating bedtime reading. Okay, now the lunge test. It's a clinical test that's commonly used to assess ankle dorsiflexion in a relatively dynamic weight-bearing method. If you only take one thing from this review of the lunge test, it should be this. It may be a simple test, but it's a significant test when performed correctly. And I'm underlining the word correctly because I recently attended a workshop on patellofemoral pain run by manipulative physio guru Ben Corso. Ben uses the lunge test as an important test for patellofemoral pain patients. And in his non-scripted practical demonstration that he did in the workshop, he observed 6 ways that the patient unwittingly cheated the test results. Now, cheating might be a bit of a harsh word to use, but every body seeks the easiest way to do things. Think of it like the path of least resistance. So if there's a limitation of ankle dorsiflexion that the patient's coming up against, they'll always try to find other ways to achieve the objective, which is to lunge, get the knee towards the wall. Now, I won't be going into the same elegant detail that Ben did in the workshop. We'll save that for another time. For now, let me summarize the way patients can cheat the lunge test and what you need to monitor in order to get accurate test results, especially for pre and post-intervention testing. And they were abducted foot position of the ankle being tested, pronation of the foot being tested, internal femoral rotation on the side being tested, medial arch collapse of the side being tested, hip restriction in the sagittal plane, and pelvis rotation. Plus, watch out for the upper body flexion in the spine. Now, it makes no difference in the measurement of the knee to the wall or the angle of the tibia, but it can give you some important clues on the intent and effort your patient is bringing to the test. Those individuals who are competitive in nature sometimes go to extraordinary lengths to try to win this test. You might need to be alert to this for your patient management strategies. Okay, so most of the focus of the patient cheating methods were on the side being tested. What about the other side? Do we need to pay any attention there? Yes, we do. So let me give you some key guidelines to follow. First, make sure the back foot is parallel to the foot being tested, the front foot. This will help you with your pre and post testing reliability and consistency. The heel of the back foot can come off the floor. That's not such an issue. Keeping parallel is essential though. The hips need to stay square to the wall throughout the whole testing process. Oh, and back to the side being tested, repeat the test while supporting the arch a little to neutral and check if this makes a difference to the test results. Alrighty, there you have it. The evidence why ankle dorsiflexion is so important for our plantar heel pain patients, as well as the multitude of MSK conditions higher up the kinetic chain. Plus the 6 ways your patients can cheat the lunge test. Has that been useful? I sure hope so. Now you're even better equipped to utilize this most important test as part of your plantar heel pain assessment. We hope you employ this information in your clinic straight away. This brings to a close the 8th and final blog on this series on plantar heel pains. We've covered some crucial elements of the ideal steps to fix plantar heel pains with ease. The ideal steps, ideal being an acronym for initial examination, diagnosis, exceptions, assessments, and long-term care. In next week's blog, I'll reveal every subcategory of each of those ideal steps. Think of it as a checklist, if you like. There's 28 subcategory items that will give you a blueprint to follow so you don't miss a thing when treating your plantar heel pain cases. This will be especially helpful for those plantar heel pain cases that get better but not fully best. You know who I mean, don't you? Yeah, those cases that just make you shudder when you see their name on your day list. Next week, I'll also reveal the clear steps on how you can get hold of everything you need to assess, diagnose and treat plantar heel pains with ease. You won't want to miss that one. Thanks for watching this video and thanks for your interest in getting more predictable outcomes for plantar heel pains. It's truly inspiring to be with health practitioners who make it their mission to get the breakthroughs that help more people like never before. Please make sure you download today's fabulous freebie on the latest ankle evidence, including the lunge test checklist. See you next week for more battle-tested plantar heel pain shortcuts. Ciao.